everybody, and welcome to episode number 67 of our Medical Minute, sponsored by Kroger Health. My name is Jill Hunt. I am one of the nurse practitioners here at Cincinnati Cancer Advisors, and it feels like forever since I have been in this seat. Thank goodness Sherry kind of keeps us rolling, but it feels like it's been a really long time. So we are going to try to do a little bit more of a clinical focus today. My co-hosts are nurse practitioner Andy Guinea-Gundo and our world-renowned Dr. Jazieh. We are going to take us back to the basics on lung cancer and do a little bit of a lung cancer 101. So we're going to really get down to some of the basics and use some of the expertise that both Dr. Jazieh and Andy have in regards to lung cancer. So I'm going to just kind of put it out there. Lung cancer kind of falls into a couple of different buckets. So either one of you, if you would like to kind of jump in and give us an explanation of what types of lung cancer are there.
Well, thank you, Jill. It's a pleasure to be with you and Andy. It's very important topic and it's dear and near to my heart, lung cancer, because I've been, interested in this disease for a while. Actually, the first thing we need to know when we are encountering the diagnosis of lung cancer is what is the type of lung cancer. And there are actually two main types of lung cancer. And there are, of course, subtypes of them. One of them is the non-small cell lung cancer, and one of them is the small cell lung cancer. And then, as I said, there are subtypes to that, But that's very important to know because the way you approach them, the treatment is different for each type of lung cancer.
Okay. Now, when we're talking lung cancer, obviously there's all kinds of things out there, lots of talk about lung cancer. When we have people who are sitting at home that are, getting more information, obviously they've been impacted. Yeah. About how many people are diagnosed each year with lung cancer?
Yeah, this is lung cancer is a big problem. When we talk about numbers of patients, it only falls second behind prostate cancer when we talk about men, and then breast cancer when we talk about women. But you talk about the full number, we're talking about over 200,000 people who are diagnosed each year with that. And then, in terms of the folks we lose every year, about half of that, about 100,000, a little bit over 100,000, who, we need to do better with.
Right, absolutely. And when we're looking at those numbers, Dr. Jazieh, can you speak a little bit to the risk factors and screening tools that are out there for people who are at higher risk for lung cancer?
Yeah, thank you. So actually, lung cancer is number one killer cancer in worldwide. And in the U.S., actually, although prostate cancer and breast cancer are higher in terms of incidence, but lung cancer kills more people than prostate cancer, breast cancer, and colon cancer combined. So it's very important, to keep this in mind that, although the interesting thing about lung cancer that 85% of cases are due to smoking. Means if people stop smoking, 85% of the cases of lung cancer would not happen. And that's very critical. In the beginning of the 20th century, lung cancer was extremely rare that the doctors used to call each other, come see a lung cancer in the floor, because it was very rare. But because of the smoking and other risk factors, the risk of lung cancer increased significantly to become number one cancer killer. Now, so smoking is number one, smoking is number two, smoking is number three, smoking is number four. Actually, so there's first-hand smoking and there's second-hand smoking, which is basically, those who get exposed to smoking from others. And and that's actually account to almost 5% of the lung cancer. And the third known risk, clearly risk factor is radon exposure, which is, this is we usually encounter in homes where the uranium is the decay of uranium, radon is the decay of uranium that seeps into the cracks of the grounds, into the basements and so on. And that's why we encourage people to check the radon exposure in their home and make sure that you do any mitigation is needed because it's also account for almost 5% of cancer. There are other risk factors, environmental and so on. They are less common, but they are there. And to a very small fraction may be genetic. I will leave that to Andy because this is his expertise. Now, there are fortunately, so the first fortunate thing about lung cancer is that it's preventable. And majority of the cases are preventable by not smoking to start with. And if you're a smoker, quit. The sooner you quit, the better, because the risk of lung cancer goes down over 10 to 15 years to become, rather than becoming 10 to 20 times the normal risk, it become only double the risk. It doesn't go completely, but it gets reduced significantly. So that's very important. Quit smoking. Don't start smoking in the first place, but if you smoke, quit smoking immediately. And then the other fortunate thing that, for those who smoke more than 20 pack a year means they smoke 1 pack for 20 years, or they smoke, 2 packs for 10 years, and they are older than age 50. There is a screening CT scan that actually can help in detecting the cancer early and save lives.
Perfect. Thank you. Obviously, for our patients who have high risk factors, are smokers, as Dr. Jazieh, or have had exposure to smoke or radon, or we're going to talk a little bit about the potential genetic risk. If we find those patients and they're diagnosed with lung cancer, can you kind of give me a broad overview of what they're looking at for some of their treatment options?
Yeah, I mean, just like any other cancer, the primary goal is to be able to cut it out. So a localized treatment. That's no different than, say, like a breast lump that you remove with a lumpectomy. Unfortunately, many times when we find these lung cancers, they're either in a spot that is hard to cut out because there's lots of important anatomical landmarks here that are hard to cut around, or also they're found too late. You have advanced disease at the time of diagnosis. So yes, cut it out is number one, and the highest rate of cure with that. Obviously the other traditional treatments like radiation therapy and chemotherapy come to the mix, but really what's revolutionized how we treat lung cancer is this immunotherapy. So immunotherapy is right up your alley with the melanoma, but basically getting our immune system to attack that cancer like it should have done from the get-go. But even beyond immunotherapy, really what has risen along with that is that we're seeing now that about 45% of lung cancers have what we call an actionable driver mutation, meaning there's a mutation within that tumor itself that can be acted upon. So there's a drug on the market to treat 45% of these markers that occur in lung tumors today. So, and that it just seems to every time you turn around, there's a new marker, and then there's a new drug that's associated with that.
Now, Dr. Jazieh, you've been doing lung cancer for quite some time. How do you feel immunotherapy and these targeted drugs has impacted the treatment of lung cancer?
Yes, this is actually was great advances over the last 10, 15 years, actually, and it changed the course of the disease significantly. While in the past, if you have somebody with the stage 4, you have very small chance of less than 5% of having 5-year survival or cure. And now, you are seeing third or more than third of the patients making it to the 5 years, and many of them are with good disease control. Also, the precision treatment with the targeted therapy we've talked about is more efficacious than standard chemotherapy and has a better outcome than with less, of course, side effect and better outcome. And we have patients now who survived lung cancer 5-10 years on these smart therapies. And, fortunately, we have more than a dozen, actionable targets in lung cancer, and some of them have 5 medications or more in the markets to treat that. So this is very important advances. And we have seen, if you look at the lung cancer cure rate, if 5-year survival was all comers was 15% and so on, now is almost more than 25%, are cured. And then we see also the other good news. We start seeing decline in the incidence of lung cancer by 2% over the last 10 years. And the death from lung cancer is decreasing by 4%. So these are all good news.
That is really good news. Now, to kind of keep with our time that we try to stick to and not get too lengthy, we were going to talk a little bit about genetics and precision oncology and some of those targeted mutations that patients can have, as well as the treatments that kind of coincide with that. But I think what we're going to do is we're going to hold that for Lung Cancer 102. We'll dig into a little bit more of the details with that. That way we are not crunched for time, and for those of you that truly are interested in kind of a higher level, we give you a little bit more, and we don't try to just cram it all in. So thank you everybody for tuning in for our Lung Cancer 101. Stay tuned sometime in the near future. We will definitely do a Lung Cancer 102 to give you a little bit more detail that may be specific to an individual. Thanks for tuning in, and we'll see you next time.